So this is a peripheral smear, and I will say this is our case 1 because different peripheral smears we'll be studying over a period of time, and we'll try to decipher how it goes. Like without knowing the diagnosis, we'll go forward, so that we try to learn to identify them. And in clinical practice, nobody tells you what's it's gonna be. You are the one who's responsible, so to diagnose it and give the clinician a clue whether you are thinking about thalassemia, or is it iron deficiency anemia or megaloblastic anemia. So the peripheral smear picture is very important. So I have decided to segregate this, and right now we'll only study RBC morphology. We won't be studying anything about WBCs or platelets. We'll go one by one. So this is case 1, and we'll be focusing on RBC morphology. Okay. So for RBC morphology, I would say look for 3 things. First is size, then is shape, and then abnormal cells. Just about this slide, when you put it under 40x, this will be visible. Maybe this is 10x, not 40x. Okay, so 10 or 40, both. All right. So what do you see? First you will see the size. Start with the size. Imagine there's this small lymphocyte. Okay, and now you have to see whether the RBC is equal to, lesser, or more in size than the small lymphocyte. So always compare to small lymphocyte. Okay, small lymphocyte. Now if it is less in size than the lymphocyte, automatically it becomes microcytic. ठीक? Okay, now when it is microcytic, now chances are that it will be hypochromic also. Now how will you deduce hypochromia? You will see the pallor inside the cell. Like a normal RBC would be this. Okay, just the central pallor. All right, but as hemoglobin reduces pallor, the white space inside RBC increases. So it can go like up to if anemia is severe, it will be like more than like 1/3. It will be more than 1/3. But in this, pallor is there, but not that much. Yeah, it's not covering more than maybe 1/3 of it, right? But still we can say that this is hypochromic. As you can see, chrome. What is chrome, by the way? It's color. What is cytic, by the way? It's a cell. Okay, micro means small, as you all know. Microscope, micro, so microbiology, anything micro is small. And hypo means something less. If it is more, then will be hyper. So for example, there's this RBC which is filled with this kind of color, and there is no central pallor, then it will be hyperchromic. But mostly hyperchromic is used for malignant cells while we are describing the nucleus. So we are mostly tackling hypochromia in hematology peripheral smears. All right. Now, so as through size we have decided that this is microcytic hypochromic with in the comparison of small lymphocyte, and also color of the pallor inside the RBC. Now next is shape. Now you have to see whether the shape is. So what is the normal shape? Normal shape is biconcave, and in 2D you will see oval. All right. So this oval, this is normal, but as anemia progresses or hemoglobin becomes less, cells assume different morphology. So it can be anything. All right. So in this, as you can see, these are teardrops. Okay, as if tears are coming out of the eyes. So these teardrops you have to mention. So teardrops cells are observed predominantly. This is how you will report it. Okay, predominantly. as you can see, teardrop. Now as soon as you see teardrop cells, look for target cells. What are target cells? Target cells will look like this. So there will be hemoglobin here, pallor area, and then another rim of hemoglobin like a cell. So it's like a bullseye. All right, so cells will be arranged like this. Size will be okay like this, but there will be a central dot of hemoglobin, then pallor, and then hemoglobin. Okay, yeah, here like this, central red color, and then this, and this whole red color will be white. I'll explain it in the next slide maybe. So in this, at least in this peripheral smear, only teardrops are present, and shape size is microcytic hypochromic. Now shape, as you can see, there are teardrops and there is a variation in size. Not every RBC looks alike, so obviously there is difference in shape as well. So you can say that there is moderate degree of anisopoikilocytosis. Anisopoikilocytosis. Okay. Moderate degree of anisopoikilocytosis. What is aniso? Difference in the size, variation of size. And poikilo is variation in shape. Variation in shape. So I can see different variation in size and I can see variation in shape. So I'll say moderate degree of an isopoikilocytosis. And in abnormal cells, I only see teardrop cells. I cannot see anything immature. RBCs are mature with the central pallor. So this is what is the diagnosis here. It will be microcytic hypochromic picture with predominant teardrop cells. Okay, teardrop morphology. When you say teardrop morphology, automatically physician or clinician or hematologist will think about thalassemia and further investigations will be carried out. But as a pathologist, your part is to suggest. So how will you suggest? You will suggest fetal hemoglobin levels, HPLC, to exclude thalassemia, because teardrop cells are predominant, so maybe target cells will be there. And so and PS you have already done. Serum iron will be done, serum ferritin will be done. Okay, serum iron will be increased in case of thalassemia, ferritin will be increased in case of thalassemia, bone marrow iron will be increased in case of thalassemia, and HbA2 levels will be increased in case of thalassemia. So after all these tests, one person, a clinician, will make a diagnosis of thalassemia. But before that, if you do not have any information around anything, then this is just microcytic hypochromic picture with teardrop cell morphology. That's it. This is how you report it. All right. So this is case 1. Further investigations will tell you whether it is thalassemia or iron deficiency anemia, but till here just microcytic hypochromic anemia.